Most people take antibiotics without giving it a second thought. You feel sick. You visit a doctor, you get a prescription, and you expect to feel better in a few days. It seems simple, right? But here's the thing. Antibiotics, like Cefixime, don't just attack the bacteria causing your infection. They can also affect other parts of your body in ways you might never expect. Some side effects are mild, like stomach upset, while others can be more serious, affecting your immune system, your blood, or even the balance of bacteria in your gut. What makes them truly dangerous is that some of these effects don't show up immediately. They can appear days or even weeks after finishing your medication. And the worst part, most people never connect these symptoms back to the antibiotic, assuming it's something else entirely. Today, we're going to reveal 5 hidden side effects of Cefixime that you should absolutely know before taking it. By the end of this video, you'll understand what to watch for, how to protect yourself, and why being informed is the first step to staying safe while using this common medication. 1. Gut imbalance and digestive issues. One of the most common but often overlooked effects of Cefixime is its impact on gut bacteria. Your digestive system contains trillions of bacteria, many of which are beneficial. These bacteria help digest food, support your immune system, and keep harmful organisms in check. When you take Cefixime, it doesn't only target the bacteria causing your infection, it can also reduce the number of good bacteria in your gut. At first, you may notice only mild bloating, slight gas, or minor changes in bowel movements. For most people, these symptoms are temporary, but sometimes the disruption lasts longer than expected. You may experience irregular bowel movements, prolonged digestive discomfort, or even yeast overgrowth. In rare cases, a dangerous bacterium called Clostridioides difficile can grow, leading to severe diarrhea and abdominal pain. What makes this side effect hidden is timing. It may not show up until days after you finish the antibiotic. Many people never connect stomach issues back to the medication, assuming it's a stomach bug or something they ate. Being aware of this can help you take action early if symptoms persist. 2. Delayed allergic reactions. Allergic reactions do not always happen immediately. Most people imagine allergies as something instant. You take a pill, and within minutes, break out in hives or your lips swell. While that can happen, some reactions are slower. Cefixime, as a cephalosporin antibiotic, can sometimes cause a rash, itching, or mild swelling several days after starting the medication. People with a history of penicillin or cephalosporin allergies may be at higher risk. The delayed nature of these reactions makes them easy to miss or misinterpret. You might blame a new soap, food, or detergent instead of the antibiotic. Because of this delay, many people do not report the reaction to their doctor, which can make treatment more complicated. If any unusual skin changes, itching or swelling occur while taking Cefixime or shortly after completing the course, it is important to seek medical advice immediately rather than ignoring the symptoms. 3. Persistent diarrhea. Beyond the usual diarrhea is a common side effect of many antibiotics, including Cefixime. Mild diarrhea for a day or two may not be concerning. However, persistent diarrhea, especially if accompanied by severe stomach cramps, fever, dehydration, or blood in the stool, can indicate a serious condition. Antibiotics disturb the balance of bacteria in the intestines, and in some cases, this can allow harmful bacteria like Clostridioides difficile to grow. Many people dismiss diarrhea as normal, when taking antibiotics and delay seeking care, which can worsen the condition. Recognizing warning signs early is crucial. If symptoms last more than a couple of days, or if they are severe, contact your healthcare provider immediately. 4. Rare changes in blood cells. Although uncommon, Cefixime has been associated in rare cases with alterations in white blood cells, red blood cells, or platelets. A drop in white blood cells can weaken your immune system, making you more susceptible to infections. A decrease in platelets may lead to easy bruising, unusual bleeding, or fatigue. These changes are often reversible once the medication is stopped, but they may go unnoticed unless blood tests are performed. Most healthy adults taking a standard short course will never experience this. But awareness is important, especially if you notice persistent fatigue, unusual bruising, or frequent infections during or shortly after treatment. Antibiotic resistance. This side effect is not something you can feel immediately, but it may be the most important. Every time antibiotics like Cefixime are used unnecessarily or incorrectly, bacteria can adapt and develop resistance. Over time, infections may become harder to treat, requiring stronger antibiotics or longer treatment. Cefixime is an important antibiotic, but misuse can reduce its effectiveness for both you and the community. Resistance develops silently and is often unnoticed until it causes real problems. That is why doctors emphasize careful, responsible prescribing and why completing the full course exactly as instructed is critical. Misusing antibiotics doesn't just impact your health, it affects everyone's. Cefixime and pregnancy. Safety. For pregnant women, Cefixime is generally considered relatively safe when prescribed by a healthcare provider. It belongs to a class of antibiotics commonly used during pregnancy when needed, and studies have not shown significant harm to the baby when taken as directed. However, no medication should be taken during pregnancy without supervision. Your doctor will weigh the benefits of treating the infection against any potential risks, and the dose may be adjusted for safety. Self-medicating during pregnancy is never safe, and any unusual symptoms, such as rash, diarrhea, or swelling, should be reported immediately. Always inform your doctor if you are pregnant or planning to become pregnant before starting any antibiotic treatment. Cefixime is an effective antibiotic for many bacterial infections, but it comes with potential hidden side effects that most people never hear about. From gut imbalance and delayed allergic reactions to persistent diarrhea, rare changes in blood cells, and the risk of antibiotic resistance, awareness is your best defense. For pregnant women, Cefixime is generally considered safe under medical supervision, but no antibiotic should be taken without a doctor's guidance. Following instructions, completing the full course, and paying attention to your body can prevent complications and ensure proper recovery. The right antibiotic, taken correctly, can heal you effectively. Misuse or ignoring warning signs can create problems that are harder to fix. Knowledge empowers you to protect your health and make safe choices. If you found this information helpful, don't forget to like, share, and subscribe for more clear and simple health guides. Comment below if you've ever taken Cefixime or have questions about antibiotics. Your experiences could help others. Stay informed, stay safe, and hit the notification bell so you never miss an important health update. Remember, the right antibiotic can heal you, the wrong use can harm you, and knowledge makes all the difference.